Now we have very important case when you have a patient who's young, like 28, with a bright red blood per rectum. What's your differential here? With abdominal pain, weight loss.
Ulcerative colitis, Crohn's disease. Yeah.
Yeah, it could be ulcerative colitis, could be Crohn, it could be diverticulitis,
Mm-hmm.
could be angiodysplasia. What else?
Look, could be there.
Yeah, it could be hemorrhoid, could be anal fissure,
Yeah.
could be infectious colitis, could be ischemic colitis.
In a young guy.
It's one of the differentials, like
Right.
colonic polyp, not necessarily just bright red blood. Colonic polyps could be that. So for ulcerative colitis and Crohn's disease, what test do we order for that? We order sigmoidoscopy or colonoscopy with rectal biopsy. Okay? And for
Okay.
infectious colitis, we order the stool, ova, parasite, white BC, and culture. And there are the routine orders that we order on everybody, which is
That was
called the
an ova
cut
infection,
gleam.
right?
What
Not
is it?
ischemic. Stool and ova is for infectious, not ischemic.
Yeah, infectious. Yeah, sorry. Okay. Yeah, if ischemic is high on differential, we may order like CT angio, but it's not too high, so we don't. And then the routine order, which is the cut glean, you remember, is CBC,
Could you go
CMP,
over,
hmm?
you know,
Yeah,
go
urinalysis, TSH, glucose, okay, lipid panel, and then we do EKG, not necessarily here. ESR is important. And then magnesium, it's not necessary too. But those are the routine plus those things. That's what you want to do, okay? Now, we talk about the management. Now, it's very important. We discuss every case. We discuss about the admission, when do you admit him, how to management, complicated management. So that's the management. So ulcerative colitis. This patient, after colonoscopy, it's ulcerative colitis. So you start off with mesalamine plus sulfasalazine.
Wait, in the U world, they wanted colonoscopy, right? They didn't want
Yeah, so ulcerative colitis, you start with mesalamine, sulfasalazine, plus folic acid. Okay? If there's a flare, you add prednisone, steroid, for flare. Okay? If it's still severe, that was not controlled on mesalamine, sulfasalazine, and steroid, then you add azathioprine.
along with all those.
Yeah, or 6-mercaptopurine. Okay? If those didn't work, then you hospitalize.
Okay.
Hospitalized for IV steroid, you give him IV steroid, and
Okay.
broad spectrum antibiotics if fever, because there's high risk of sepsis. And then the last resort is surgery. That's important thing. Now the symptomatic management. If there's diarrhea, what do we give him? Loperamide.
Uh,
If there's
Allopurinol.
if there's a cramps, what do we give him?
Dicyclamine or
Yeah,
something.
we give him anticholinergics. If there's mood problem, what do we give him? We give him SSRI. It's your specialty. Dietary, if there's we do dietary consult for everyone. Okay, and then we do colonoscopy schedule in 8 to 10 years, okay, after diagnosis, and 2 to 3 years after the 8 years we do colonoscopy, and then 2 to 3 afterward. Okay, so this is gonna be helpful not only for CCS but for the MCQ questions too. So in a summary,
Okay.
we do
Hold on. Hold on.
cut
Hold on.
glean.
Hold on. In the colonoscopy after.
Okay, so in a summary, we do cut gleam, sigmoidoscopy, stool, that's what we write, and then we give mesalamine, sulfasalazine, we give a steroid. Loperamide, anticholinergic if there is cramps, and dietary consult. That's the main thing. Okay?
Oh.
Period.